So some general care measures for respiratory illnesses. There are 8 major goals that we look at. Okay, so first we want to ease respiratory efforts. We always want to make it easier for that person to breathe. 2 major interventions that are overlooked is humidify and hydrate. Humidify the room. If your patient is on supplemental O2, try to get a humidifier on that O2. Okay, humidify and hydrate. So humidify the outside, hydrate the inside. We want to make sure they're hydrated, and that helps prevent or helps decrease the stickiness and stuff of mucus, makes it easier to get mucus up. We also want to position our patients in a way that makes breathing easier. So some elevation is usually helpful. If we are trying to maintain an airway, we don't want to either flex too much or extend too much. We want to put babies in sniffing position for maximum airway. And for littles especially, we want to keep their noses clear. We want to promote rest. So we do that by encouraging quiet play, by trying not to wake up a sleeping child when we can avoid it. Now make sure that you're assessing when you come on your shift, but you've got to, you can work around that sleep schedule as much as possible. Try to cluster overnight or cluster interventions and meds that are potentially interrupting sleep. Promote comfort. Again, keep their noses clear. We don't want people using vasoconstrictive nose drops for more than 3 days, because what happens is you get rebound congestion. Vapor rubs can be used on kids older than 2, so that's going to have eucalyptus or something like that in it that's going to that should open airways up some, or open their nasal passages some. Warm packs and cold packs can help with pain and discomfort. There are a lot of over-the-counter meds aimed at cold symptoms, because colds can be miserable. None of those are recommended for small children. And the reason is there have been some fatal overdoses. So there are a couple of different things. Number one is dosing ranges. The range may be pretty small, especially on small kids. At one time, we actually, and I haven't seen infant drops in a while, they may still be there, but if we look at acetaminophen infant drops and acetaminophen children's elixir, those are different concentrations. So if you give a dose of the infant drops based on, if you're told to give them a teaspoon of Tylenol, you give them a teaspoon of infant drops, that's a massive overdose. And there's also, parents who give a child adult doses of those over-the-counter meds. A lot of families think, or a lot of people think, that if it's over-the-counter, it's safe, so we can just not worry about how much we're giving. Another risk, though, is combination meds, and there are a lot of these in the cold medicine line. And sometimes we end up with someone taking multiple doses of the same medication or medications in the same class. So we want to make sure that we're giving really good teaching about over-the-counter meds, and over-the-counter cold meds are not generally recommended for infants and toddlers. We want to prevent the spread of infection. That's hand washing, avoiding shared utensils when someone is sick, and keeping sick kids at home. Now, general rules for keeping kids at home are fever-free without meds for 24 hours, no diarrhea or vomiting. There are a lot of parents who, for various reasons, medicate their child with some ibuprofen, send them to school sick. That keeps their temp down till nearly the end of the day, and by that time they've been through the whole school day. Now, why do parents do that? There are different reasons. Some parents cannot afford to be off work. Some parents don't get paid on days they don't work. Some parents don't have sick days. Some parents do not, or their jobs are at risk if they don't go to work, if they miss a day. Another reason, though, is that schools may have pretty strict attendance policies. And if a child's missed a certain number of days in some schools, the parent is then going to be in trouble with truancy. So there's a lot of pressure to send kids to school, even if they're sick. But we really should be making it possible for sick kids to stay home. Reducing the temperature. Fever fights infection, but it contributes to fluid loss. Any high fever should be treated. If a child has a history of febrile seizures, fever should be treated. Lower fevers may actually help fight the infection, and so parents may not choose to treat lower fevers unless the child just seems really miserable. But if the child is running fever, they need extra fluids because they're going to lose more fluids. We need to make sure that parents know how to check temperature properly. The most accurate way to check temperature in a home setting is going to be rectal. But rectal temps have some risk. And so usually we can get a good enough reading with other methods that are less invasive and less risky. We just need to make sure that the parent knows how to actually use whatever type thermometer they're using. We need to know if parents know how to administer over-the-counter fever meds. Do they know the correct doses of ibuprofen, acetaminophen? Do they know the safest way to administer those? And some other things for temp, we can do cold baths, compresses, light clothing, a fan. I know a lot of parents will bundle up a baby or a child who has fever because they think they're going to sweat it out, but that just tends to make the temp go higher. So we want to do cool baths, light clothing, a fan, cool drinks, not cold, but cool. Same thing with baths. We don't want ice baths. We want cool baths. And we want to avoid cooling them so quickly they start to shiver because that will raise their temp back up, and that uses a lot of energy. Promoting hydration. We recommend that they avoid caffeine because that can cause dehydration. It causes some diuresis. If they're vomiting or not taking fluid well, we want to teach the parents to offer small amounts of fluid frequently, because you can get, I've even had times that we're doing a medicine cup every 15 or 20 minutes until they can hold a little bit more. Sports drinks are not recommended because of the sugar content. That sugar content can actually cause diarrhea. There are pediatric electrolyte solutions that can be used. I know that a lot of people do use sports drinks, so we can encourage them to maybe use half strength. If the child breastfeeds, they almost always need to continue breastfeeding because not only does that provide hydration, it provides comfort, and it provides antibiotics so it can help fight that infection. We need to teach parents the signs of dehydration. It's infrequent voiding, a sunken appearance, poor skin turgor, lethargy, and lack of tears when crying. If they're crying and have no tears, that child is very dehydrated and needs to be evaluated. We want to provide nutrition. For a short-term respiratory illness, kids may just not eat all that well for a few days, and that's okay. We want to provide small, frequent feedings and not push it. Kids who are sicker for a longer time, we may have more concerns about adequate nutrition. And then support teaching and home care. We want to support families in comforting a fussy child, make sure that they're dosing over-the-counter meds correctly. Antibiotics should be taken only if they're prescribed for that specific child, for that specific illness, and then the parents need to make sure the child takes the entire course of antibiotics. And antibiotics are not needed for viral illnesses. There are so many people who think, I've got a cold, I'll go get an antibiotic, I'll be better faster. And not only that, but then they don't complete the course, they save it, and they give it to the other kid the next time. So we really need to do lots and lots of teaching about antibiotics. All right, in the next section, we're going to start breaking down different respiratory disorders.